after the very wonderful introduction, and please accept my gratitude for the kind invitation to address the august teachers, another very respected profession. So the topic is science and spirituality. And please look at this topic for a while, because these are two separate subjects we are going to talk about, science and spirituality. So coming to a great physicist of our times, Nikola Tesla, one of whose invention, many of whose inventions we are using. This remote session is a gift of his. It was he who discovered this technology, radar technology, mobile technology. He was an alternative current, to say the least, a very great physicist. And he predicted that the age of religion and politics was over, and the future will belong to science and spirituality. And this was in last century that he predicted this coming together of these two very diverse fields. So what is science? As I mentioned early on, actually any activity in which it can be a systematic study of structure or function or physical world or natural world, anything that we do through observation and experimentation, and we come out with repeated and reproducible results. That is basically what is the domain of science. So based on this, we often put together science as something different from spirituality. But let me mention another great human being who lived on this planet, Swami Vivekananda. And we all very often consider him to be a spiritual giant, but we forget that he was a great advocator of science. And it is said that the first patent from our country, you can see Dr. J.C. Bose with his telephone. It was Swami Vivekananda who convinced Dr. J.C. Bose to file a patent, because he was not very keen on filing a patent. And it is said that Swamiji convinced him, and it is believed that he himself carried the patent application while going to the United States. So it is incorrect to think that a spiritual giant, he was against science, or he was unscientific, or he did not know anything of science, because these greats from both worlds have already known that these two are similar sounding. These are same entities. Spirituality is a science, and science cannot do without spirituality. So with that background, two great people from extremes of specialities, one a great scientist, physicist, and the other a great spiritual scientist or a spiritual giant. What are the sciences that we know? So everything that happens inside the atom, inside the molecules which make our body, which make the material world, to the outer world in the cosmos, everything that happens comes under the domain of science. So we've divided them into physical sciences, social sciences, life sciences, of which we belong to pharmacy and biology. Physical sciences like physics, chemistry, they follow the same principle. So these are all encompassing science. Nothing can be beyond science. But let me take you back to my specialty, which is cardiology. Very briefly digress from the topic so as to emphasize my point. You all must have experienced or know somebody who's had a heart attack in the family or in the neighborhood, or you keep reading about it. So what happens when there is heart attack? I think most of you must be aware of it. We have arteries supplying blood to the heart. We call them coronary arteries. And when plaque deposition happens, obstruction develops in the vessels. This is because of our faulty lifestyle. And when one fine day suddenly this ruptures, then what we develop is what we call a heart attack. And I want you to go through this very brief film.
Like all muscles in your body, your heart needs oxygen to live and work. Special blood vessels on the surface of your heart, called coronary arteries, deliver oxygen to your heart muscle.
So when there is
Plaque
this
can build up
blockage
in the
forms,
coronary arteries. If the plaque ruptures, a blood clot can form, blocking blood flow.
so this clotting
When too
occurs,
little oxygen
no
reaches the heart
further
muscle,
blood
the
flow
muscle tissue
distal
dies.
to this
This
blockage,
is called a heart attack.
and the muscle
The
tissue dies.
damaged heart muscle may potentially lead to other heart
Can be a
conditions.
large sized muscle injury, can be a small sized muscle injury. The heart can suddenly stop during heart attack. You can have sudden death during the period of heart attack. Or if we survive, we are fortunate enough to survive, we report to a hospital where further management is done. But at our age, everybody who is above 30, 35, we've known that plaque formation starts even after 1 year of childhood. So these blockages are forming, and all of us, if we look at our angiograms, we will have some degree of blockage already formed in our coronary arteries. So why is this blockage happening, and what are the risk factors? In medicine, we have recognized these 9 risk factors, which we call directly, and they have been well proven by systematic large scale studies on all the continents, all races across the globe, that these 9 risk factors are able to explain 90% of the occurrence of heart attack. And only then we label them as risk factors. We know that environmental pollution also contributes. We know that mobile radiation may be causing it, but studies have not reached to this level to label them as risk factors. Besides, there are many factors in the blood also which can contribute, but which have not reached the status of a risk factor. So a risk factor is one which has been clearly, without any doubt, being proven to be associated with causing this disease. In this case, heart attack. So causality has been established by each of these risk factors. So out of these 9, 2 are what we label them as non-modifiable risk factors. One is advancing age, and the other is a family history of early heart disease in our family. So 2 of these we cannot do anything about because our age goes on increasing, and a family history, if we have inherited a family history, then we can't change that family. But rest 7 out of 9 are what we call modifiable risk factors or lifestyle related risk factors. And this is where I want to talk about. All of this is what is in our control. Abnormal cholesterol levels, high blood pressure, overweight or obesity, diabetes, cigarette smoking, tobacco consumption in any form, stress. So they've already had sessions on stress, I believe. So stress is a very important risk factor for heart attacks, apart from many other diseases that it can cause, and lack of physical activity. So all these, if you look at them, are related to our lifestyle, what we eat, how much we exercise, how we sleep, or how much stressed we are, what is our mental makeup. This determines these lifestyle related risk factors. So 7 out of 9 in our control. But why am I talking about this is because many of us are under the misconception that even now, because we are living in this COVID pandemic time, we believe that communicable diseases are the major killers, especially in poor countries like India, countries of Africa, Southeast Asia. It is the infections like tuberculosis, malaria, dengue, which cause most of the deaths. But it is not true. This is from the World Health Organization data 2012, which shows that the major killer of the world are the non-communicable diseases. And number one amongst them is the cardiovascular disease, of which a sample I showed about heart attacks, cancers, lung disorders, and diabetes. So these are the commonest killers of our times. Communicable diseases are much less in number in the modern era. So non-communicable diseases are the killers even in countries like India and even in developing economies like South America and even Africa. So please keep this in mind that this is what affects all of us. And if this data is reflective of the world, of our country, then these are the causes we are most likely to succumb to. We will survive probably infections, but this is the highest probability that we will have death due to one of the non-communicable diseases. So of course, science has made plenty of progress. We have tremendous researches going on across the globe, particularly in the last 50 years, when modern medicine largely came about after the discovery of penicillin, the first antibiotic, 1950s. We've come a very long way indeed. And a salute to our scientist community in the biological sciences to have given us the wonderful remedies, have conducted researches. So we know what is the right diet to eat to prevent heart attack, plenty of fruits, vegetables, salads. We know the benefits of physical exercise at several levels, not only heart disease, but immunity also now we are talking about. So numerous benefits of physical activity. We have very well researched molecules brought out by our pharmacy community in terms of wonderful drugs, which not only have disease lowering incidence, but also mortality benefits. They increase our survival. And we have these technologies like stenting in the coronary arteries or bypass surgery. So all these are offered to a cardiac patient, and whenever there is risk of heart disease, uh, dietary advice, physical activity, drugs are prescribed. And if you have survived a heart attack, probably one of these two procedures is also to be done. But in spite of this wonderful advancement that we've made in the period of time, the scenario or the report card of the world is not very good. So this is a snapshot from a very good study published in the Lancet in 2011, the PURE study. This was the prospective urban-rural epidemiological study, and this was carried out to see the use of these four powerful drugs, the most powerful drugs we have in cardiology, which lower mortality apart from the risk of heart attacks. These are antiplatelet agents, beta blockers, ACE inhibitors or ARBs, and statins. So we studied the use of these four drugs across the globe in people who have already survived a life-threatening heart attack or stroke. And the communities were divided in terms of their financial status: high income countries, upper middle income, low middle income, and low income countries. So you will not be surprised to know that across the world, 4 years after an index event of heart attack or stroke, even in high income countries, one of the most educated societies, the intake of these life saving drugs is around 50 to 60% only. And as we go down the economic status, which correlates to an extent with the literacy status, in low income countries, hardly 10% of the people are taking these drugs even after an index event, which is a life threatening event. 10-20% intake, and this is the same situation in urban as well as rural area. What is surprising is that even in the most developed countries of the world, almost 50% of the people are not following appropriate medications as they should be taking. So as pharmacists, as researchers, and as doctors, if we keep looking at wonderful newer molecules, very effective molecules are being brought out by us, but if the patients are not taking them, it is not surprise that non-communicable diseases are continuing to rise and will continue to rise. So the answer clearly does not lie in discovering newer drugs, because unless the people are going to take those drugs, we can do nothing about the health of the planet. Unless we cannot force people to continue taking these drugs. It was further studies that even in countries where drugs were provided free of cost, patients were not taking these drugs after a period of time, mainly because they don't feel anything, they don't see any changes happening in their life even after taking this drug for some time, because these are silent benefits when the patients are looking for something tangible, something perceptible. So there is a new paradigm which is emerging, that clearly our strategies are discovering, researching newer drugs, newer uh, techniques like stenting, bypass surgeries is not going to have a great impact, is not having a great impact at all. If we have to strike, we have to strike at the root, which is at the behavior of the people. The behavior of the average human being, he should be looking at something which the patients want. And what do the patients want? What do you want? In general, we want wellness, we want to be healthy, we want to prevent disease before it occurs, rather than have a heart attack because I can afford to get a bypass done at a fancy hospital. So I can carry on having an unhealthy lifestyle. No, we all want to prevent disease. We want to be remedies which are safe, which are natural, which are simple to practice. We know that you won't take a drug which is to be taken 5 times in a day. You're more likely to take a drug which is required once a week only. So we need simple natural remedies which are no doubt effective, but we also want affordable remedy, if possible free of cost. Those drugs which are available free of cost, our uptake is much more, like supplementation, etc. And we want to have holistic health. It is not that I just give you a drug for preventing heart attack, but you have to take another drug for acidity, you have to take another drug for your stroke, another drug for feeling good, or another drug for your mood disorder. So this is a new paradigm which is emerging, and this is the demand from the patient side. This is what all of us as patients want. We want everything in one package. And this is where the role of meditation and something like heartfulness meditation is coming up in a big way. And this is where meditation is entering the domain of medicine and wellness in a very big way. So again, I take you back to almost 15 years, and this is the cover of the most popular magazine, the Time magazine. And what you can see is a Hollywood actor doing meditation, and they have labeled it as the science of meditation already 15 years ago. And we in India are still having the topic of science and meditation. So I'm glad that now it is science of meditation, because meditation in the West has already been accepted as a scientific enterprise, and they are doing researches related to meditation. So this was one of the first studies done with functional MRI, and they examined people while they were doing meditation with the help of functional MRI to just see what goes on in the brain when one sits down to do meditative practices. And within 10 minutes, this is before, this is after, just 10 minutes of meditation, overall, there was a significant change in the brainwave pattern from irregular activity to completely coherent activities in the brain. It is not just a very silent or passive exercise that we are doing, just closing our eyes and doing something. Active changes happen in the brain, and which are all known to be beneficial. There are many evidences related to what happens when the frontal lobe is inactivated, what happens to amygdala, a part of the hypothalamus. And it is very well now, it is very popular in the corporate circles to avoid amygdala hijack, to avoid from people losing their fuse at short instances. And then, as we say, you become angry and you lose your mind, they end up taking harmful decisions. So to avoid amygdala hijack, meditation is being seen as a wonderful tool, and numerous workshops are happening in one of the biggest corporates you can name in the world. Similarly, other interesting research that has come about is in the field of genetics, because as students of biology, I was taught that genes are the final frontier. What we have inherited determines our destiny, and what diseases we will have, what kind of height we will have, what color of skin, color of eyes, all that is imprinted in my genetic formula, which I have inherited, and there is very little I can do about it. But the field of epigenetics is changing all that, which has clearly shown that there is a genetic background, yes, but the expression of the genes depends on the stimuli which come from the environment. And depending on the stimulus, the genetic expression can be completely changed. So epigenetics is putting the ball out of the court of genetics, and it is the control lies outside the genotype and not is limited to genotype. Similarly, this wonderful book, The Heart's Code, is a very remarkable compilation of the numerous researches that have already been done in the field of researching spirituality and coupling it together with medicine. And they have very startling revelations to make. And these are all published papers in respected scientific journals. For example, we have been listening since childhood that the heart feels, the heart communicates. Even the Bollywood industry has been teaching us that dil toot jata hai or dil rota hai. So we used to laugh about it, like heart is nothing except a pump. We still teach that in biology, that heart is merely a muscular pump, and the brain is the seat of thinking and logistics and everything. But these wonderful researchers have now shown that heart has the capacity to feel. The heart does communicate with other organs of the body and even outside the body. A remarkable thing that this book begins with is, if you look at the electrocardiogram, which we do day in and day out, the ECG, we connect electrodes to the skin of the patient, from which even the microvolts of current are picked up, which are generated in the heart, and we come across a pattern. So the question is, do the electric impulses coming from the heart stop at the skin, or those vibrations are still carried beyond the skin into the outer atmosphere, and they are able to influence the surrounding atmosphere? And there are compiled experiment in this book which clearly shows that when we sit close to a saintly person, a good person, we can feel the good vibes. And what are these vibrations or vibes other than the impulses coming from the heart? Similarly, if we sit close to a dacoit or a cheat or a fearful person, we seem to have that fear in the atmosphere and we are able to catch it. So, how do you explain that? Which sense organ are you using to perceive those things? It is clearly the heart and only the heart which is able to feel, which is the seat of emotions, and which is able to communicate and capture these things even from outer environment. And this is what our sages and saints in the year have already been saying. So there's another book, Biology of Belief, by another cell biologist, Dr. Bruce Lipton, is a wonderful compilation of his experiments on how he's now a hardcore proponent of these aspects, and a new term like quantum biology is now being taught, because what we have been taught is particle biology, which is not true. He clearly showed that a bone cell, if kept in a petri dish, is supposed to form the bone. If we change the environment of the bone cell, it will form a muscle instead of a bone. So just by changing the environment, we can completely alter the genetic expression. And we are all a compilation of same cells only. And what is the environment of cells? Is the neuronal and the hormonal milieu that the cell is surrounded by. If there is more of serotonin hormone, we will feel happy. If there is a depletion of serotonin hormone, then we will feel depressed. So the chemical environment of the cell determines our overall state. If we can change our chemical environment by a simple practice like thinking positively, thinking appropriately, thinking good thoughts, and meditating, then this is how a simple practice of meditation can translate into tangible changes even at the cellular and subcellular levels. And this is where maximum research is now happening. How a simple practice like meditation can alter so much of structure in the body. So we already know that thoughts can affect cells in turn, even the DNA inside the cells. The heart has the ability to feel, to communicate, and even remember. There have been studies on patients of heart transplant, which we have clearly shown that after a transplant, their personality is completely altered. And in some cases, it resembled the personality of the person whose heart was donated. So if the heart is only a muscular pump, then how could this happen? If heart did not have ability to remember, then how could the transplant patients sometimes remember episodes in life which had never happened in their life, which actually had happened in the donor's life? So these are startling experiments which are already published in the scientific domain, and we are coming to these conclusions that in fact heart has a greater role to play in the body than just being a muscular pump. Similarly, we have this field of neuroplasticity, which states that neurons and the connection of the neurons can be changed. So here we think about habits. So we in fact can change our habits, alter our patterns of thinking and behavior by altering our neuronal connections. And how to do that? We do not have to do surgeries, nor it is possible to open up the brain and make submicroscopic neuronal connections. This can all alter by just practices, very simple practices in the abstract, like meditation. So this is where meditation is coming in a big way in the field of holistic health. Holistic health means when we talk of health, we just don't talk of physical health. You may be healthy in the body, you may not have any disease right now, but you are a total mess in your mind. You are depressed, you are sleep deprived, you cannot control focus your mind for a minute. So you're clearly not healthy. And if we do not have a spiritual basis, then again we are imbalanced. So the WHO definition of health encompasses the physical, mental, as well as social and spiritual well-being. And meditation is being seen as a wonderful approach to ensuring overall holistic health, because there are researches which clearly show that meditation can clearly improve our metabolism, help in our physical aspects like lowering of blood pressure, helping lose weight, quality of sleep. It has a greatest role in managing our minds. So it is the number one tool worldwide now for stress management. Even in hospital settings, you will be recommended meditation for any kind of stress, depression before we jump on to prescribing you drugs. And the benefits are well known. The benefits related to the spiritual aspect can never be studied because this is a totally different dimension. You need instruments which are related to that dimension, which is clearly not possible. So I'll share with you some brief evidences of how in medical science we've taken it up as a tool which can help in improving our health. And this is a publication from European Journal of Preventive Cardiology. This is a sorry state of affairs that still these aspects are also being researched much more in the West than we are doing it ourselves. Although we take pride in claiming that this is something which has our ancestors knew thousands of years ago, but it is again coming through the West with the root of science. So this is a compilation of more than 37 randomized controlled trials, a meta-analysis, which was done to see the effectiveness of different kinds of yoga in modifying the risk factors for heart disease. The risk factors which I just showed you. It was shown that yoga had significant improvement in body mass index. So for losing weight, again, it can help. For blood pressure, it definitely helped. And it also lowered low density cholesterol. Although no significant difference was observed between yoga and physical exercise. So it was as good as going for jogging. And those who practice yoga regularly had similar benefits which were obtained by people who went for other physical exercises. Similarly, the American Heart Association, there have been many research papers which have been published with different kinds of meditation practices and their impact on blood pressure. So there is enough data now, and this compelled the American Heart Association 3 years ago to publish this scientific statement allowing meditation to be used as a tool, as a lifestyle measure. And they recommend that all patients of high blood pressure which come to physicians, cardiologists, we normally recommend salt restriction, a healthy diet, plenty of fruits, vegetables, physical exercises, walking, jogging. And now they also recommend to add meditation. So this is a American Heart Association statement which approves the role of meditation in lowering down blood pressure. And as such, we should discuss this with all patients who come to us with high blood pressure. Similarly, other risk factors, if I talk about, I showed you several of them, and cigarette smoking is one of the worst risk factors to get rid of, because if there was a drug, we would have given the drug to people and people would have been able to stop smoking. It is a very difficult habit to quit because it again alters the brain circuitry. You become tolerant, you become dependent, and you do not function normally if you do not smoke after a certain stage. So it is a very difficult thing to get rid of. I have patients who have been trying hard to quit, but they are not able to quit smoking and they're like addicts now. So an experiment was done, and this wonderful study with mindfulness meditation, they showed that just 5 hours in total of meditation exposure, or for 2 weeks, a structured program of meditation was offered. 60% of people were able to quit smoking. This was a remedy which was more effective than any other remedy tried so far, and in very little investment of time. And as pharmacy people, you will understand that this came without any side effect. And of course, no cost in some of the systems like heartfulness. I'll discuss that later. So, a wonderful remedy for getting rid of harmful habits that we want to change in ourselves. And smoking is one of the most powerful risk factor and the commonest cause for heart attacks in the young world over. We have a patient who is 24 years old coming to us with heart attack, smoking just 1 month. He got a new job, started smoking, ended up with a heart attack. Heart's pumping is already half. Not to talk of cancers and other major diseases it can have. So, if you want to get rid of this, again, behavioral change is what is required, and this is a tool where meditation is coming in a big way. Before this pandemic of corona took over, we already knew that we were dealing with a silent pandemic called the psychosocial stress. This has been going on for decades. We have been becoming more and more financially better and better. We earn almost 10 times our ancestors did ever, but still our stress levels are worst which were ever, even in times of World War and even in times of Great Depression in 1920s. We did not have so much stress as we are having now. And this is a silent killer of the times, which not only is a risk factor for heart attack, it causes many, many other diseases also. And the worst problem is we do not know how to diagnose stress. Nobody has a blood test. Nobody will accept that he or she is stressed. And we don't know what is a tool to deal with stress. So a study was done, again a meta-analysis of almost 47 randomized controlled trials, more than 3,500 patients, all these trials included. And we compared it to the effect size of all the antidepressant drugs put together. So interestingly, the effect size of meditation was exactly the same as the effect size of all the antidepressant drugs put together, with the benefits of no side effect and no attendant abuse and addiction and tolerance and all these problems which are associated with antidepressant medication. And we all know that these have numerous side effects and very harmful side effects, antidepressant medication. So again, meditation is the number one tool because of these evidences for stress management worldwide now. We at Heartfulness Institute are also been conducting research at several levels across the globe. And this is one study which was done in one of the hospital settings of the US, because again, a very stressful environment exists in the healthcare sector, particularly in a large hospital setting because of several reasons. So this study was conducted in a hospital setting. Half the subjects were offered heartfulness meditation sessions, 3 consecutive days, and they were continued to practice after 12 weeks. And half the people were not followed, not given the meditation session. So these were two groups, one practicing heartfulness meditation regularly for 12 weeks, and the other not practicing heartfulness meditation and carrying on as before. And we, before and after questionnaires were filled, and we compared their emotional state before and after. So at the end of 12 weeks, there was significant increase in joy, calmness, tolerance, quality of sleep, self-confidence, and positive attributes like this, and significant decrease in negative emotions like anger, stress, cynicism, irritability, and even burnout, which is a major factor corporate setups look at. Very easily, we are seeing burnout happening very early in our careers now in the workforce. And a very interesting aspect was that in the younger population in the meditation group, there was a significant increase in the telomere length. So telomere are the terminal parts of the chromosome, and these are associated with overall immunity, health, wear and tear of aging, and survival. So if your telomere length is longer, you are likely to have better immunity, better cellular health, and you're likely to live longer. So meditation just for 12 weeks resulted in an increase in telomere length. So another demonstration of how a simple practice like closing your eyes and meditating with the heartfulness system has impact even at the DNA level. So this was published in one of the journals in 2015. And we at Max Hospital Saket, where I work in Delhi, we also did a study. And for this purpose, we partnered with the IIT Delhi, which was a part of the study. So in collaboration with IIT Delhi, I was part of this study. And we examined the heartfulness meditation practitioners. We invited them to our hospital setting. And over a period of 2 hours, we subjected them for 30 minutes of sitting quietly, 30 minutes of heartfulness cleaning, which is a unique practice with heartfulness. I think you will be told about it or you will have a workshop. And 30 minutes of heartfulness meditation was offered to them. And during this period, we were continuously monitoring their ECG with the help of a Holter monitor. And we also measured their blood pressure before and after each of the exercise. Before cleaning, after cleaning, before meditation, after meditation. So this was a remarkable study, and we could clearly demonstrate a shift in heart rate variability happening with cleaning as well as meditation, a significant level being achieved. Similarly, in terms of heart rate, maximum heart rate, we started with an average of around 97, came down to 90 with the practice of cleaning, which further came down to 88, significantly lowered in terms of maximum heart rate. And the higher the heart rate, the greater the risk. The lower the heart rate you have, the longer you live. So an act of meditation for just 30 minutes brings your heart rate down. And in general, meditators have a lower heart rate as compared to non-meditators. So the shift on heart rate variability indicated that when you do heartfulness cleaning and meditation, we switch over from a sympathetic state, which is the excited, agitated state, to a more calm and relaxed parasympathetic nervous system state. So this is what meditation and cleaning does to you. You are brought in a parasympathetic dominant state, which is the more calm, composed, relaxed state, and which is the best state to have. If you are always in the stress mode, always in the fight, flight, or fear mode, then your sympathetic dominance will be there. And if you meditate, you will come to a more relaxed, calm state, because we demonstrated that this happens because it switches over from the sympathetic nervous system to the parasympathetic nervous system. And this study was published in the premier cardiology journal of our country, the Indian Heart Journal. And this was very much appreciated in the media across the country, where we had publications related to a particular brand of study. And even IIT scholars were part of the study. So this got very good coverage. And finally, I'm happy to share with you that my title has changed from Science of Meditation, Science and Meditation, to Science of Meditation, even in our country now. And this was a cover story by India Today about heartfulness meditation and how scientifically done practices can have a beneficial impact on the body. And this was the first good quality study from our country related to this aspect, which was published. So, what happens when we meditate? A lot of research is happening across the globe, across the specialities, to look at the effect of meditation on the body. We already know that there are endocrine effects. Cortisol levels or the stress hormone levels go down. The feel good hormone, happiness hormone, serotonin, oxytocin levels go up. Similarly, sleep quality majorly improves in people who meditate regularly. And sleep, as you know, is the major casualty of our times. Majority of people are not able to sleep properly, not having restful sleep. So melatonin levels responsible for sleep goes up. Similarly, positive changes in the nervous system. We are mostly parasympathetic dominant if we meditate. Well, non-meditators are generally stressed because we are always in the fear, fight, flight mode, which is the sympathetic dominance. Similarly, other effects like improved basal metabolic rate, improved BMI, improved muscle strength, immunity gets better, reduced oxygen consumption. So all these are being worked at, and newer researches are coming up establishing the role. I showed you one slide of a functional MRI which looked at the brainwave pattern. So we now know that when you meditate, particularly with the heartfulness system, very soon from the excited, awake beta state, which is the irregular high frequency activity of the brainwave, we go into the theta and delta waveform, which is like a very deep sleep, but it is actually not sleep. And this is a state where we are most productive, most creative. Most of the discoveries, like what Newton saw in falling of an apple, what Archimedes suddenly hit upon, was believed to be in this state of mind. These discoveries were not made when you were sitting at a desk, thinking very seriously, concentrating hard, but these discoveries were made when you were relaxed, you were unconscious, and then from deep within our consciousness, we get intuitive insights into things. So, this is what most of the time meditative people are into, a very relaxed state of mind where creativity is maximum, intuitive insights are maximum. Similarly, we now know that students, say school students or college students, if we are in this state, then we are able to learn better, we are able to retain better. And that is why it is now being recommended and being practiced. Workshops are happening in many universities and colleges of the country and abroad also. We are doing a lot of heartfulness programs across the country and outside India for schools and colleges also. At one time, we had a request to conduct a meditation workshop in Madagascar for close to 18,000 students schools, because the benefits are now being accepted all over the globe. So clearly, across the globe, in terms of health, in terms of wellness, uh, meditation is clearly the buzzword. And 10 years ago, I used to be shy of telling people that I meditate because it would generally be that kuch to gadbad hai iske saath. Something is wrong with him. Meditating, why is into all these things? Something has gone wrong. And I would have to answer unnecessary questions. But now it's very clear that this is a wave which is going across the globe. And there are many evidences to this effect that spirituality is not to be dismissed as unscientific, as having no basis, as something which does not work, as something which take years and years of practice and ordinary people, working people cannot do it. All that is changing now. And these are some evidences. So almost 50% of the US patients visit complementary health practitioners. So this is not just a phenomena unique to India, that we see patients who reject allopathic medicines. Very few people who are following allopathic medicine, and most of the people will like to combine them with some of the Ayurvedic prescriptions without any scientific basis for us. But this is what people are doing because this is what people are feeling better about. So if these practices can make them feel better, then why not embrace them? And then why not allow them and why not study them for their beneficial aspect? So most of the patients have in the US these different therapies like radioanesthesia, electrotherapy, chiropractic, energy healing, which we used to dismiss as students of science. But now we need to look at them seriously because probably they are feeling good, they are feeling better. So we should also embrace these practices. Similarly, taking clue, the National Institute of Health in the US, which is a very stringent body, has now created an alternative medicine branch, and you are allowed to practice in these specialities like alternative medicine specialities. So this phenomena is not only happening in our country, happening abroad also. Similarly, major teaching hospitals are allowing these practitioners to visit the hospitals and treat the patients along with modern medicine which is being practiced in these hospitals. And insurance companies are starting to pay claims for these kind of treatments also. So this is all a recognition of these esoteric practices based in, some of these are definitely based in spirituality. So rather than just being very dismissive of these practices, I think we need to have a scientific temper and take them as such. Similarly, a lot of research grants are becoming available. We had a big research proposal coming in from Department of Science and Technology, Ministry of Ayush, for researches related to spirituality and the pandemic or immunity or in any way which could support the role of these practices in meditation, these practices in improving overall health. Similarly, the UN announced 21st June as International Yoga Day unanimously in no time. All the countries approved it because we have intuitively known the benefits that these practices can bring to us. So there was no point, and everybody embraced, and it was approved within no day, and we have been celebrating it for so long. So schools, colleges, public sector giants like the armed forces of our country, the railways, the Central Industrial Security Force, many corporates in the private sector, universities, schools, they're all embracing. And at least one such workshop is going on any given day today with heartfulness, I can tell you, which is the proof that people are taking up to these practices very quickly and they are finding benefit in these practices. So some kind of stress management strategy, some kind of wellness strategy is if it is to be offered, then why not? And all of these are based at meditation practices. So these are one of the few snapshots of people in the US Army before going to war being taught meditation, children in school having a meditation session before they go to their periods, corporate setups, meditating at the workplace. In societies, we have special programs targeted at special groups. For medical colleges, for example, the Gujarat government has mandated that all the medical colleges in Gujarat have to be trained. All the students and faculty are to be given heartfulness meditation sessions which will be carried forward to students and who will further benefit in terms of their own personal health and enhancing the health of their patients also. Another evidence, if you look at it, if you remember, which was a bestseller in 2018, if I ask you on Amazon, probably you will think that some autobiography of a film star or a cricketer or Mr. Raghuram Rajan or some big shot like Steve Jobs. But no, the number one bestseller in 2018 was this book about the heartfulness practices, released by none other than the president of our country, who himself is a self-proclaimed heartfulness meditation practitioner for more than 20 years now. And this book continued to chop the chart the whole of the year. Similarly, the next year also, this book written by the Global Guide of Heartfulness Institute, Kamlesh Patel. Interestingly, for you to know, he is a pharmacist with a very successful chain of practice in the US, a chain of pharmacy in New York, and is a very good student of pharmacy from Ahmedabad. He went over to the US and equally adept at spiritual practices. He is now heading the organization of Heartfulness Institute. He's written these wonderful books, and these have continued to be the bestseller. So to summarize, the science of meditation, I believe you are now with me. Not everything that matters can be measured. The esoteric aspects can only be experienced. So we do not have instruments to measure these feelings and emotions that we experience during meditation. So different kinds of scientific experiments have to be done. And we need to develop these kind of instruments which can actually demonstrate these benefits. Functional MRI was one of that. The laws of particle physics in which we have been trained and particle biology which we keep teaching doesn't apply at these levels. So we need to have an alternative method of studying this. So that is why quantum biology is the new field which is now coming up, where we know that even thoughts can have an effect on matter. And I end with another great scientist, perhaps the greatest of our times, who also said that the most beautiful and profound emotion we can experience is the sensation of the mystical. It is the power of all true science. So let us not be dismissive of these practices, and let us just give it a fair try for some time before we reject these practices and enrich our lives by regularly doing what we are doing in our practical life, but also incorporate these practices in our day-to-day lives. So I would humbly request all of you to just visit this website, read a bit about the heartfulness system, download this app, Hearts app, freely available, and all the practices related to heartfulness are always offered free of cost. There is no fee ever charged for any kind of service that we offer in terms of meditation practices. And you can get in touch with any of the trainers around, of which there are thousands and thousands, and you can experience this for yourself and take home the benefits of these practices. So with that, I think I'll end the session now. And if there are any questions, I'll be happy to take them.